Wisconsin, Dr. Devin Welsh from Alta V again to show you the second of our more common tape applications that we'll do for postpartum wrist pain. As I mentioned in the last video, it's really common to get pain on the outside of the wrist after having baby. This is based on a slew of factors. You can read our blog if you want to learn more about it. But this is the tape job that I like to do if that wrist pain is more on the thumb side as opposed to the wrist side, because there are kind of two different variations. This does overlap with a like tech thumb kind of overuse injury as well. So you'll notice that I have cut my strip in kind of a Y, and that I have rounded all of my edges, including these small edges. That helps the tape to stay on and not to catch. So it's important to round your edges. And then the reason why I have these two little Ys, you can kind of like tear the backs under the Y, is because I'm actually gonna wrap around the thumb with this. And I may have made these a little bit long, but that's okay. So just like with the last application, I'm going to apply the tape right on the thumb side of the wrist and going into the forearm. She's at kind of a neutral position here. We haven't pre-positioned her too much. And then from there, I'm going to take my two little Y tails and I'm going to, one at a time, wrap them around the thumb. Now go slow and don't put too much stretch in your tape as you're applying. That's the most common mistake people make when they're doing their tape applications, is too much stretch. You do too much stretch, you can actually even give yourself a friction irritation or even a blister. So we don't want to do that, and it'll come off easier too. So we're gonna go slow and around with both of our little Y tails there, trying not to get any wrinkles in the tape, because that can be just irritating. But as you can see, that's gonna give her pretty decent feedback coming in around the joint. With kinesiology tape, it's not gonna hold her in that position, it's not rigid. She's still gonna have full range of motion in that thumb, but her brain's gonna be getting more feedback. So then I did my decompression strip again, just like in the last video, where I fold it in half and then rip it. Does not need to be perfect. But when we're doing our decompression strip, we do a little bit of stretch and kind of apply the middle first, and then no stretch as we put those anchors down. And I'm still gonna do my decompression strip more at the wrist than the thumb, just because that's hard to do and I've already given the thumb tons of support. You could do just that thumb one here, but I find when we go around the retinaculum that gives a nice amount of feedback for stability as well. So that is our tape job, keeping in mind that finishing on tape is not going to stay as well as finishing on skin, making sure everything's nice and smooth. But this is a nice, and Devin can model for us, this is a nice way to support when it's more of a thumb pain in that postpartum wrist injury as opposed to the wrist itself.